I'm Dr. Rajesh Vasu, plastic surgeon, and in today's video we're going to be talking about something which is a very hot topic and something which increasingly we are seeing. We are hearing requests from our patients about correcting their aging signs. So here we're going to talk about thread lifts. So what are these thread lifts? So these are medically graded threads which are inserted into selective areas of the face which can correct the aging signs. Now what do we mean by selective areas and what are these aging signs? So you must understand that as early as 40 or as early as 50 years one may see aging signs in the face, and that can be, there can be a sag of the skin causing folds in the nasolabial or the laugh line, or there can also be folds in the marionette area, and this can also cause jowling in the lower border of the mandible, causing a disruption of this line and making it look a little wavy. So these are all the changes, early changes of aging, which can actually create concerns for our patients. Now you all will know that the changes of aging classically can be addressed by a facelift, but not all our patients want a facelift. Not all our patients want to go through a surgery. Not all our patients want to go through the pain and the swelling which is there with surgeries. So this is where the thread lifts fill in this gap, and these are minimally invasive. There's hardly any downtime, there is no pain, and the recovery is almost immediate, and the result is there for you to be seen. But these can address only the mild to moderate signs of aging. So that's what is important to remember. So the early aging signs, where you have a drop of the fat, a drop of the skin causing heaviness in the laugh lines, heaviness in the marionette lines, and also causing heaviness in the jawline. This is something that can be addressed by these threads. Not only these areas, you can also use the threads to improve the aging signs of the neck, as well as you can also use it for the eyebrows. The eyebrows with aging can actually droop or sag, and these could also be lifted like you would have a fox-tailed eyebrows. When we talk about aging, do not imagine that threads can correct the severe signs of aging like heavy folds, the fat is really sagging, the necks are really heavy, lot of fat. No, these are not the signs or changes which can be corrected by thread lifts. Thread lifts address only the mild to moderate changes of aging. Very early signs of aging can be addressed with these threads. So we are looking at a person who's in their 40s and 50s who have subtle changes and just about age catching up, just about these signs showing. Somebody may comment that they're looking a little tired. Somebody may say that they're looking angry at times. So these are the patients who can really benefit from the thread lifts. In today's world, we have so much of technology which is available to us for actually correcting the aging face. Like you can get patients actually asking us, can we use threads with other treatments? What are these other treatments? You are aware of the HIFU, high intensity focused ultrasound. This is nothing but a heat energy which is passed in the form of ultrasonic waves, and this helps in actually bringing about changes in the skin. So HIFU is one treatment which is used for the aging phase, and of course, yes, it can be combined with the thread. Now there are other technologies which can be combined with the thread lifting, and these are radio frequency in the form of Morpheus 8 technology, where you find the fractional radio frequency is passed into the depths of the skin, thereby helping in building up collagen, thereby helping in skin contraction. And often these threads can be combined with these treatments, but there is a spacing. So once you do the threads, you generally wait for around 2 to 3 weeks before you can use these additional treatments to get a better effect. So these are all synergistic treatments which give a much better effect, and thereby giving much better results for the patient and keeping them happy for a longer period of time. So these treatments, of course, they can be combined with threads. The thread lift starts off with the consultation. At the consultation, we do a facial analysis. We see what is the kind of skin the patient has, what is the kind of sag, what are the deformities, like I told you about the laugh lines which are prominent, whether they are mild or whether they are very severe, and we see all the other changes in the aging face. Now, once we consider that these are mild to moderate changes, this is the time when we tell the patient that they could probably benefit by threads which actually enable a lifting effect, a minimal lifting effect, which brings in the youthful appearance and which takes away all the signs of aging. Now, once the initial consultation, the analysis of the face happens, and we tell our patients that threads is probably one of the options for them. Then we take the consent of the patient and tell them that what we're going to be doing. We first mark the patient. We mark the patient where the areas which we want to lift. Like let's say if this particular patient has a very prominent nasolabial fold, we probably would be putting around 3 threads over here, and then we would be using another thread to lift the chin area, and one which lifts the angle of the lower border of the mandible of the jaw, and we actually mark these areas on both sides over here. We photograph them and then we start the procedure. The procedure is a very simple procedure. It's done under local anesthesia. The point of entry, there's no cut mark, there's no cutting at all. It's just a point of entry with a very fine needle, and this is just above the prominence of the zygomatic, the cheekbone over here, just above that, and then we make a small incision after giving local anesthesia, one over here, and the all other incisions are the injection points are made where the needle is actually reaching the skin, and once you give this along the track where you're going to pass the thread, we inject a small dose of anesthesia on both sides and keep the patient calm. Usually this suffices for our patients. They're really comfortable, absolutely no pain, and then we start the threading procedure where we pass serially one thread after the other and get a complete lift on both sides and achieve the symmetry. And once we do the passage of the threads, the extra edges are actually pulled and cut flush with the skin so that there's no prominence of the threads or jutting out of the threads through the hole that we've made. So usually the procedure is done under local anesthesia, and it gets done in half an hour of time, and there's really no problems with the procedure. Like I said, the threads, the thread lift, it's the instantaneous result is always there for you to see, and the patient in front of the mirror appreciates the subtle lift. Usually the lift is around 1 to 1.5 centimeters, which they can see in the mirror, and this usually lasts for almost up to 1.5 to 2 years. That's the beauty of the latest threads which we use, the Aptos Visage Excellence threads, and these usually last for around 1.5 to 2 years. Now, what are the commonest things that we see? There could be some amount of swelling because we inject a lot of anesthesia just below the skin, so that can cause some amount of swelling, and there can be some amount of redness because we use cannulae, but these are all blunt cannulae, so the amount of bleeding, the amount of bruising is very, very less. But in those patients who have a very thin skin, you can expect some amount of bruising, but this bruising can be again corrected by giving ice compresses for every 2 hours and for maybe 1 or 2 days, and it usually settles down in 4 to 5 days of time. But most of our Indian patients, they can actually go back to work on the next day, and things are practically not visible. Now, threads, these have been used by surgeons from time immemorial, and these are very, very safe threads to be used, and they cause no reaction whatsoever, and absolutely they can be used without any risk of allergic reactions, without any exposure, without any extrusions, and they can be safely used in our patients. Side effects, like I mentioned, there could be occasional pain at the time of the procedure. There could be some amount of redness, there could be some amount of swelling, there could be some amount of bruising, At the most, patients may notice some amount of asymmetries, very minor asymmetries, and lastly, there could be some amount of depressions from where we have injected or where we have passed the thread, but that could get evened out by massages. So we tell our patients that once the threads are done, they should always do massages upwards towards the upper part of the ear, so that this movement causes maximum engagement of the skin and soft tissue with the clogs of the threads, which are a crucial part of the threads, and this causes an engagement and this causes a lift, and this lift will usually last for almost 1.5 to 2 years. I use the Aptos Visage Excellence threads, and these threads are made of PLLA and PCA, and it comes embedded with hyaluronic acid, so there's a constant release of hyaluronic acid, giving you that plump and the full look. So the results of the PLA and the PCL combination, these last for almost 1.5 to 2 years, unlike the PDO threads, which last for probably 5 to 6 months. So the Aptos threads, they give you a much better look because of they're much stronger than the PDO threads, and because of the hyaluronic acid which is embedded in the threads, the result is much better. It's very important to know how these threads actually work. Now, these are medical graded threads, and they come in different types, but the commonest threads that we as plastic surgeons use are the barbed threads. Now, because of the aging signs, we want a lift. So because we want that lift, we use what is called as barbs. Barbs are nothing but these are all breaks in the threads, which are like arrows, and when they're pulled up against their direction, they actually anchor the tissues, and they hold that way and not sag again. So the barbs are very important to hold the soft tissues and the fat inside, and then that gives that pull, and then because of the direction of the pull, the threads are actually inserted into these areas where there's a lot of condensation of the supportive connective tissue, which actually anchors the thread at a much higher level. So if you're looking at doing the mid cheek and the jaw, the threads are actually in this direction, and they're actually being anchored somewhere over here. And it's also important that the threads are not going to damage any vessels or any nerves. That's very important to know, and it is kept at a level where it is just below the dermis of the skin, so that it anchors the subcutaneous fat and pulls it up. So to conclude, I think as plastic surgeons, we have found a very effective treatment for the aging signs, especially the mild to moderate signs of aging. It's such a popular request which comes from our patients, and definitely the threads fit into the armamentarium for plastic surgeons, and comes very handy. And because of the non-invasiveness, because of no downtime, patients can actually get it done. The results are very noticeable instantly, and they last for almost 1.5 to 2 years. And because of the safety and because of no harmful side effects, it can absolutely be done by our patients, almost like a lunch hour procedure.